everybody. My name is Dr. Farina Khan, and I am a intern resident physician at Roseburg Family Medicine Residency Program in Roseburg, Oregon, in the United States. I was asked to create a quick video clip to discuss different opportunities that are available after obtaining your medical degree, whether it's an MD or a DO or an MBBS or some other kind of degree. So one of the first options that are available are to apply for postgraduate training or residency. And this can be pursued in many different countries, whether it's the US or Canada or a country in Europe or the Middle East or in Australia or whatever country you wish to work in. And what that is allowing you to continue training after graduating from medical school to be able to pursue full licensure in that country, to be able to practice. And that can vary depending on what specialty you're doing a residency in. At least here in the US, most of your basic medical residencies are about 3 years or 4 years long, versus if you go into something more specialized, like surgery, it can take several additional years. And after residency, you can go ahead and do additional specialization training, which is referred to as fellowship. And depending on which one it is, that can take an additional year or so. Another option is for you to do like an internship year, or what some countries call house job. So that's 1 year of additional training, which some countries structure as getting 6 years of medical and 6 years of surgical training at the level of a first year intern. And a lot of other countries, such as the UK and Australia, actually require that as a component before being able to practice in their system. So if you're able to get that done, depending on where you went to med school, it's probably not a bad idea to consider for the sake of your CV and building an additional skill set. A couple other opportunities. So in the US, there's a lot of people that apply for residency, but they don't end up getting it the first time around or the second time around, and sometimes it takes numerous cycles because unfortunately in the US there are a lot more people applying for a lot less available spots. So every year there's several thousand people that don't end up getting a residency position, and then you try to figure out what you should be doing in the meanwhile to kind of keep your clinical skills recent and in active use. So a couple states within the US have created programs either called the assistant physician or the associate physician, which allows medical school graduates who have not yet completed their postgraduate residency training to be able to work under fully licensed physicians, to be able to provide care in specific specialties, and a lot of time also in specifically medically underserved areas. So Missouri was the first state that went ahead with this kind of program, but other states such as Utah and Arizona have created their own versions of this program, and other states in the US are slowly following suit to create similar opportunities. If you move beyond basic medical opportunities, you have some other adjacent opportunities that you could use either to sort of supplement your CV while you're trying to pursue full clinical medicine, or as an alternative if you decide that clinical medicine isn't where your kind of long-term interests ultimately lie. So one field to consider would be research, which is divided into lab-based research or doing clinical research, where either there's like clinical trials involved or you're recruiting patients to kind of test different interventions or different studies. And then you kind of put together a research paper and then you submit it into a journal. Besides research, there's also opportunities within the pharmaceutical world, again, whether it's based on the pharmacological aspect of clinical trials, or you're working to become like a medical science liaison, for example, where you, using your background as an MD, you use that to sell either medications or you sell medical devices. Another option is consultancy, where you're able to, again, use your background medical knowledge and provide healthcare information to different groups, whether it's at an occupational level or, depending on what that other company is looking for. There's also opportunities available within the public health sector for people that have their MD and are kind of wanting to help out in terms of public health, whether it's in the form of epidemiology or more with public health management, or in terms of, the social determinants of health. There's also opportunities such as becoming a medical assistant or a scribe or a lab technician or a phlebotomist, or to kind of continue to supplement your medical skills until you're looking to match into residency, for example, or again, just trying to fill the gap. There's people that after their MD decide to pursue a nurse practitioner position, or they can end up pursuing a physician assistant position. So both of those are considered mid-level providers. So those are a couple of different things to think about. You're more than welcome to contact me if you want more information about some of these opportunities. Some I have personal experience with, and other ones I can connect you to other people that are more familiar with them. So I hope this was helpful, and thank you so much for your time, and good luck with everything that you're trying to accomplish.